So this is a 50-year-old lady who presents with no background history of note, otherwise employed and healthy person, and presents now with the problem of an injured left middle finger PRP joint. Once again, for the students, always start with history, then examination. The history is about the patient and then the problem. The patient is a 50-year-old, otherwise well working person. The current history is that she injured the finger 2 days ago in an altercation and showed us a picture on her phone of what looked like a volar dislocation of this PRP joint. Difficult to be sure. Then you look, and the most obvious thing to see, except for the evidence of strapping of this finger, is the flexed position of the PRP joint with the hyperextended position of the DRP joint. Whenever you see a PRP joint injury, you're not sure whether this is just a sprain of the ligaments of the PRP joint causing a flexed position, or this is a true boutonnie. A boutonnie is a very uncommon injury. We only see literally a few of those every year in this very busy clinic. How would you make the differentiation? So she can make this finger straight. So if you look at it, it's swollen around the PRP joint. There's hyperextension of the DRP joint. If you can feel that there's a boggy tenderness, boggy mass over the central slip of the extensor tendon, and there's really not much else to notice. It's not actually that sore, and the ligaments from side to side are stable. Then you want to move, and she can actively extend when you place her into that position. But if she makes a fist, make a fist. Okay, and now I ask her to extend. You see she can't fully extend, but once again, if I put her into straight, she can hold it there. So this is typical of a true Boutonnie deformity. What's happened in the Boutonnie deformity is the central slip of the extensor tendon has pulled off the bone, but the two lateral bands are still intact, coming into the base of the terminal phalanx. So one of the tests for a Boutonnie is called Elson's test. If you ask in a normal finger, if you ask the patient to extend the PRP joint, extend there, make it straight, then there should be relative laxity of the DRP joint because she's using the central slip, not the lateral bands, to make this finger straight. On this finger, if she asks her to push, she can't generate any force, and this goes very tight. I can't actually bend this because she's using the lateral bands to try and straighten the finger. So this is a typical Boutonnie deformity, and it needs to be splintered in the straight position for 6 weeks, leaving the DRP joint free so that she can bend this fingertip down hard to keep the lateral bands gliding and allow the central slip to reattach to the bone. 6 weeks in the splint, and referral to a hand clinic is imperative.